What is this, the public option? What do you think about it?
The public option is a compromise that was agreed upon. How to say this? It's a very difficult task, passing health reform. We all know that. The health industrial complex has a huge amount of money. They're spending $1.4 million a day on lobbyists. They have 6 lobbyists per member of Congress pushing them in their direction. It's a formidable opponent. And so those who felt like we should try to get something came up with the idea of a publicly funded health plan that could perhaps compete with private insurance and provide an affordable choice for Americans. And it was an idea that had some merit if you would be able to perhaps create this very strong public plan. But it was starting the discussion from a position of compromise. They didn't feel like they could go for the whole thing, so we'll try to do something that we think we can pass. And what we've seen from the beginning is that there's been such an effort to water it down that it's become really not something that's going to be effective in any way. It's going to be constrained to many of the same constraints that the private insurers have in terms of having to negotiate with hospitals and with providers. In many ways, it's just not going to achieve the goal that they wanted to achieve. It's not going to be open to everybody. It's not going to achieve cost savings. It's not going to change the fundamental problems that we have here on this private insurance model. So PNHP really struggled with how to address the public option because we understand the desire to do something. People are suffering. But as a professional organization, we felt like we had to advocate based on reform that we could look at the evidence and say this reform is going to make a difference. And if you look at the evidence for how public and private health plans have competed in this country over the last decades, the private always wins. They always are able to attract the healthiest patients while the public takes on the higher cost patients and then fails due to the high health costs that they have to incur. So evidence really points to the fact that this is not going to be a sustainable solution and that we need to go for the whole solution, which is a national publicly funded single-payer health system. Although we understand where people are coming from is not to be supportive of that. And we believe, like I said early on, President Obama knows single-payer is the solution. He even said it in a press conference in July when he was pushed. And somebody said, well, how many uninsured are you willing to tolerate? Are you okay if we just have 10 million uninsured? Are you okay if we just have 30 million uninsured? And he said, the only way we're going to cover everybody is through a national single-payer health system. So he gets it. But again, we've got to be there for him, and we've got to be pushing him through our actions. It was really interesting being in Congress as the process was moving forward because there was actually a lot of hesitation on the different committees to even put language. They had like titles for each of the different sections of the legislation, but they were so hesitant to actually fill in the blank because they knew as soon as they put specifics down, the opposition was going to be out there in full force. And that's what we saw by the end of July when all that language came out. You saw what happened in August as people came out kicking and screaming. So this is not a pretty picture right now in DC. It is going to be a battle. We don't see things moving along quickly. If they're able to pass health reform this year, which is still an if, it may be November or December before we even start seeing some real votes on legislation. So this is our window of opportunity right now to push for a real solution, to push for the Wiener Amendment, to continue educating. And I didn't mention the Kucinich Amendment, which was another significant milestone. It was an amendment passed with bipartisan support that would help states to get a single-payer bill. It gives them the waivers that they need when they pass their single-payer bill to enact it. And so for you, particularly here in California, that is very important because you have passed single-payer twice here in this state. You guys are a real inspiration to the rest of the country. So in Washington, we need you to continue putting pressure on your legislators for that Kucinich and that Wiener Amendment. And we also need to demonstrate They still don't get it. They still don't understand in Congress the magnitude of suffering and deaths that are occurring in this country. They still don't see the human faces. It would be beautiful if we had patients walking the halls of Congress as well, letting them know that we demand a real solution. If we had patients calling their offices and saying, I'm going bankrupt, or I can't afford my prescriptions, or I can't work because I can't control my high blood pressure or my asthma or my diabetes, so I can't take care of my family. They need to know this from each of us.